Disclaimer information on this program is not intended to replace or supplement the medical advice of your physician or clinician. This program is intended to provide general information, education on a variety of medical topics, but it's not intended to diagnose or treat individual symptoms or medical conditions.
It's time for Ask the Doctor at 1 o'clock. It is my honor. You got Lily, Jane before you. And today we have Dr. Bettina Morency with a heap of experience. I'll let her get into that with FCHC, Florida Community Health Centers. Today we're talking about mental health overall, but as it relates to children and adolescents, I am honored to be sitting beside this vessel that has the intelligence that we need to be informed on dealing with our children and the children in the community, and some things that we overlooked when we were the adolescents. I thank you all for joining us here at the Village Radio, WJGW 107.5 FM. If you don't have the app, get it now. Until you do, I'm going to release to Dr. Morency. I'm going to allow her to express who she is and what she comes with, and we're going to go forward with today's discussion, mental health. But forget about yourself in adolescence.
Hi, everybody. My name is Dr. Bettina Morency. I am a medical doctor. I am specialized in pediatrics, so I'm a pediatrician. I am working at Florida Community Health Center. I started with them back in July. Before them, I used to be at Broward Health for residency. Today, we'll be talking about mental health in the pediatric population. I feel like mental health in general is very important, but of course, as I'm focused in pediatrics, I would like to talk about that today because it's not just physical health that's important. Your child's mental health is very important too. We tend to focus on vaccines and checkups and physicals for school, but mental health is a big part of helping our children learn, thrive, and grow.
Okay, so I'm excited. What are some things that we should be paying attention to as parents, as, you know, individuals in the community when it comes down to the kids stopping at our house for a frozen cup? What should we be aware of? And before you answer, my question is, will we notice it differently if it's something that we went through when we were, you know, children or, well, pediatric, and it was untreated? Because things are changing now. Times are changing to where a lot of things that we didn't address in our community back in the day is being addressed now. Mm-hmm. How do I identify?
Yes, that's a very good question. So it actually depends on the age. So pediatrics is from birth until up to 18 years of age, and sometimes up to 21, depending on the type of practice that you go to. Our practice, Florida Community Health Center, is up to 18 years of age. After 18, you go to the adult side, right? So that means I see a lot of different stages of the child's life, right? So obviously, a newborn is not going to act the same way as a 5-year-old, and a 5-year-old not the same as a teenager, a 15-year-old, etc., right? So it depends on the age. So when they're smaller, like toddler school age, so when I say toddler and school age, I'm talking about maybe 2 years old, 3 years old. School age is 8, 9, etc., right? These kids, every time they wake up and they're about to go to school, they complain of a stomach ache, or they have trouble sleeping, or they're acting out, whether it's at home or in school, right? So that's mostly for the school age children. They don't really know how they're feeling, so it's kind of hard for them to say, hey mom, I'm depressed, or hey mom, I'm anxious.
Is it safe, not to cut you off, but is it safe to assume that a 4-year-old can deal with depression? Like, what can they possibly be depressed about?
So that's
how do I respond right if I receive what they're saying?
So that's hard because they have to know, number one, what depression is, what it means, right? There are some really, really smart 4-year-olds out there. I've met kids on a spectrum, you know, whether they're able to talk to me in full sentences, and sometimes they're not. So sometimes they're aware of how they're feeling, right? But I don't think they're going to be able to say, hey, mom, I'm depressed, or hey, mom, I'm anxious. It's really those symptoms that I talked about earlier that they'll be experiencing. But also it depends on what's happening in their lives too, right? If a child is having nothing happen, like they don't have any debts in the family or any major issues, we don't really start screening them that young. Oh. It's usually up to around 11 that we start, 12 years old, 13 years old, right? So it's hard to say, like, can a 4-year-old say I'm depressed? But you can watch the symptoms and also screen them if they have a major things happening, like their father died. I had a patient, their father recently died, and they started having stomach aches and vomiting for no reason. Every night they started vomiting. So that's just an example. And like I was saying earlier, for the teenagers, like the 11-year-olds, 12-year-olds, the symptoms are different, right? They're not gonna have the stomach aches, and they're not gonna be, telling you that, oh, I don't want to go to school in the morning. They're able to, unfortunately, not talk to the parents, but sometimes to the doctors, saying, yes, I do feel this way. I can't sleep at night. I can't fall asleep.
I want to ask you a question, again, not to cut you off, but this is what dialogue is. How would you share with regular people like me your take on whether or not the 10-year-old, the 11-year-old, the preteen, the teenager, how honest do you think they are when it's time to reveal this to the doctor? Because you just said, they may not talk to parents. Mm-hmm. How much more do they talk to the doctors?
A lot more.
How do you get in front of it?
A lot more, believe it or not, right?
Okay.
So there's this thing in pediatrics called the HEADS exam, the HEADS questionnaire, right? So that starts, it depends on, like I said, the clinician, but you can start at 11, at 12, at 13. I started at 11. Mm-hmm. And HEADS basically means you ask the patient, the teenager, about their home life, about their education, about their sleep, if they're sexually active, about their diet, about their safety, and also about suicidal or homicidal ideations, right? Ideally, you're supposed to have the parent step out for them to discuss with the doctor. That is ideal, right? So at that time, I always...
How realistic is that?
It happens, yeah. Okay. Some parents are totally okay with, after when
we want them to be that open
exactly.
with whoever
and
they're
sometimes
willing.
They're just not going to be open if the parent is around. I'll give you an example in a little bit, but they're just not going to be open when the parent is around. Of course, after they share with me whatever they have to share, I always encourage them to share with the parent. I don't push, I highly encourage, and I say, hey, I'll be here so we can talk to the parent with you, because at the end of the day, the parent needs to know, right? But anyway, for the HEADS exam, I asked the parent, hey, we asked this question at these ages, and I would like for you to step out if you're comfortable so I can talk to your son or to your daughter, right? And a majority of the parents are okay with it, and they step out, right? Mm-hmm. So the patients are more honest with me that way when their parents are not in the room. So I tend to ask, just like I said, about sex, about if they're suicidal, about their depression screen, etc. Back to the depression screen. So I'm not the one who does the depression screen. It's the medical assistants, right? Okay. So usually the parents are in the room while they take the patients to go in another room to measure them, to take their height, their weight, their blood pressure, etc., right? So at that time, that's when the depression screen happens. And if it's high or if it's abnormal, then I go in and I say, hey, I ask the questions again, and I ask what's going on in the house.
Wow, that's a lot. First of all, thank you for your service, because our young people need that. It's my understanding. I have a 16-year-old, so I'm finding out more and more every day that they all have their own trials and tribulations and issues of life, and it's not the same as when we were 16. So thank
Social
you for
media.
being an
Okay, that's a whole nother subject.
The internet within itself, yes,
that's
we didn't
a whole
have
nother
that.
subject.
And so there's this unhealthy pressure that pushes them to, I'll just call it the unknown, because I'd be confused. I still don't know what 6, 7 mean, but it's a young person thing. So I thank you for this being your specialty. Now, outside of being able to look for it and then identify it, what else do parents and community liaisons need to be aware of as it relates to this subject matter, which we're talking about mental health.
Yeah. So I'm not sure if I don't answer your question, let me know. But I feel like in our culture, the Black culture, I'm Haitian, so trust me, I know this. In the Haitian culture, in the Hispanic culture, I know this from personal experience, but I also see it too in my patients, right? We don't really believe in problems with mental health, right? I'm Christian, but especially Christians, I've noticed that there's no such thing. It's like everything is physical, but as soon as it's mental health, it's, it's a demon, or somebody is doing this to me or doing this to our family, right? Which, of course, like that can happen, but God placed providers in this world to help you, right? So yes, you have to pray. Exactly. Yes, you have to pray.
I believe in prayer, the altar, and the couch.
Exactly. Okay, so you pray, you always pray. That is number one, because God is the ultimate healer, the ultimate provider, the ultimate doctor, right? But you also have to use the resources that He put in place for you in this earth, and that is the providers, right? Because you can't do everything alone. So if you see that your child is experiencing these things and you're just saying, oh no, like they'll be fine, God will make a way, He will. Okay, but you also have to act. And how do you act? You go and you see the provider, the pediatrician, and you tell them, hey, I am concerned about my child. I've noticed this, I've noticed that. Can you please talk to them for me? So you have to initiate this conversation, because sometimes the child will not. Sometimes they think they're okay, or sometimes they're just, maybe this is how life is.
They don't know no better. They don't know any further.
Exactly. So as the parent, you have to talk to your child. And it's hard, especially in our community, because at the Florida community, we serve a lot of the underserved population. So these parents are always at work. The kids are left with a babysitter, or they're left at home alone, and we don't have time to talk to our kids. We don't. They're just on social media the whole day, comparing themselves with other people. Literally, that's all they do. Compare, oh, I don't have this. And you know what that leads to? That leads to depression. That leads to anxiety. That leads to, oh my gosh, like I don't have what they have, right? So I'm sad. I'm going to kill myself, right? This is exactly what happens. So you have to talk to your child no matter how old. I know it's tough, especially in the adolescent population, because they're so confused, because there's just so many things happening to them inside and outside, right? Their circles are changing, right? Their interests are changing, right? Their hormones are all over the place. They're confused, right? So it's important for us to check in on them. And sometimes they don't want to talk to the parent, which is why as the parent, you have to go to the pediatrician and say, hey, I need you to talk to my child. Yeah, so the stigma about how mental health is not a thing, or, like, oh, forget about it. Why do you need medication? Why do you need this? Why do you need that? No, that's doing a disservice to our kids, because these kids are going to grow up and are not going to be able to function, right? They're either going to hurt themselves, and you've seen that on social media, right? A lot of kids, a lot of teenagers, a lot of young adults are hurting themselves and killing themselves. Some kids cut. Like I've seen that so many times in the last few months.
So you see that in real life cases currently?
Yeah, of course. Because when I'm examining,
it's not like a thing of the past. So it's not like an old thing that we saw on the internet 5 years ago. It still happens.
No, oh my gosh! At the hospital at Broward Health, I used to see it all the time, and here in the outpatient setting in the clinics, I'm seeing it too. Because I have to examine the patient from top to bottom.
How do we as parents respond to that? When we have a cutter that is depressed or oppressed or suicidal or homicidal because of everyday life, how does the adult respond in a way that the child needs so that they eventually overcome and come out? Like, what's the right answer?
Support and community. Because this is not something that you can handle alone, right?
Okay.
Some parents, like I said, they get angry. Like, well, after all that I've done.
Confusion makes you frustrated.
Exactly.
Sometimes when you don't understand.
Exactly. But also because, like you said, they don't understand what mental health is, right? there's a stigma around it. So it's like, how dare you feel this way after all that I've done for you?
Girl, you better preach.
Okay.
Hold on, man. You preach.
After all that I've done for you, how dare you feel this way? You should be happy. You should be grateful. You know, there are people that have it worse, and rich people are depressed. Rich people have anxiety. It's not about the amount of money you have, the amount of food that you have at home. It's a feeling. It's a disorder. It's a problem that you have, right? So number one is anger. Sometimes there's denial. It's like, I don't believe in that. Like, what's wrong with them? They'll be fine. They just need to be strong and get over it, you know? So as a parent, yes, it's very hard to deal with that, because I always say this, and I don't know if this sounds wrong, but for something physical, at least there's something you can treat.
Right. I believe anything with a name, I know a name that's greater than.
Okay. It's physically, it's like, oh, they have a rash. I know how I can treat that immediately. You know, there's something physical, tangible that you can see, whether it's inside the body or outside the body. But when it comes to mental health, you can't really put that into, you can't really fix that unless
it's not tangible.
Exactly.
So what do I do?
Exactly. So that's not something that parents are able to do alone. You have to, if you're Christian, you have to go to God. Okay, you have to pray, of course, but you also have to get the help you need. That's why we have behavioral therapists. We have psychologists. They talk to the patients. They figure out what's going on. It doesn't matter what age. There is a therapist for every age. And then you decide on whether or not you need medication, if that's something you're interested in.
I have to ask you this question. And first of all, I'm so intrigued. Thank you for being a wealth of knowledge. But how do you respond as the physician when you can identify that the child is not so forthcoming? You know there's an issue. You know it would be classified as this, but they don't open to you. Mm-hmm. How do you then treat/respond to this to get them on the other side of it?
Well,
because there is that need to get them on the other side of
it. Before I even approach a child, I always say, hey, this is a question that I ask everybody. You're safe with me. Whatever we talk about stays in this room, okay? I want to make sure that you are healthy. I want to make sure that you are safe. I am not going to hurt you. I make them feel comfortable so they can open up to me. And most of the time they do, right?
Okay, so it's not really in the right setting, in the right environment, with the right temperature. You don't really get the pushback.
No, if you make them comfortable, if you make them feel safe, usually they tell you how they feel because they're looking for an escape. They're looking for somebody for somebody to understand. They probably don't know what's going on with them, right? But that's why we have the depression screen. The depression screen doesn't just ask, do you feel down? No, it has that question, do you ever feel down, hopeless? But it asks you other questions too.
So I have to ask you this. For some parents who are just parenting and surviving and preparing for the holidays and got to figure out Christmas and all this other stuff, outside of being, are you feeling down today? What are some other questions that are in the depression questionnaire that we can maybe be aware of to even identify if this is a subject matter to address with the physicians on behalf of our children as it relates to advocacy? What more is on that questionnaire?
You have to ask about sleep. That's one of the main things. The first few questions in the questionnaire, right? Because whenever a patient is having trouble with their mental health, whether it's anxiety, whether it's depression, they either can't fall asleep or they fall asleep and they wake up early, right? So that's one of the questions. As a parent, a lot of parents say, oh, they go to bed or I put them to bed at 8 p.m. But I look at the patient, what time do you actually sleep? Right?
Probably 11, right?
Exactly. And I'm like, why do you sleep that late? Is it because you're on your phone or is it because you can't sleep?
The mind doesn't settle.
Exactly. And they're either telling me, oh, I'm on my phone, or I can't fall asleep, or I fall asleep and I wake up at 2 a.m. all the time. And, like I'm thinking about this.
Let me ask you this question. For the parent, for the single mom, the single dad, for the households that don't have that insurance to come to the Florida Community Health Centers, after they identify that sleep is an issue, is there any home remedies to aid in what they are aware of until their finances match the need?
Okay, first of all, shameless plug. At Florida Community Health Center, we have a sliding fee. You don't have to have health insurance as long as you show us proof of whatever you're making, or if you're not making any money, you just show us proof of that, or you sign a paper that says, hey, this is how much money I make, or here's my W-2, here's my tax returns, here's my paychecks. We put you on a sliding fee schedule. So for a visit, you can pay, $0, $25, $75, $100, whatever schedule that you meet, right? Number one. So there is always help available, whether or not you're able to pay at Florida Community Health Centers. And we have locations at Fort Pierce, we have Port St. Lucie, we have Okeechobee, we have everywhere, right? Number one. Number two, you know how when you get hurt and there's a bruise, right? And you're bleeding and it hurts and you put a Band-Aid on it, right? When you take off the Band-Aid, the bruise is still there. The bleeding is still there, right? So you're temporarily fixing the situation, right? So let's say you go to your child and your child says, Mom, I can't sleep. I feel like I'm always up, or I sleep and then I wake up in the middle of the night and I can't go back to sleep, right? So how are you going to know if it is truly just a sleep problem or if it's depression or anxiety, right? So you can say, I'm going to treat this sleep issue, but how do you know it's not something deeper? So you can put a Band-Aid on the, quote unquote, bruise, right? But how do you know that you're fixing?
It's not a result of.
Exactly. So as for if it's just a sleep issue and you've already figured out that it's a sleep issue, we can use melatonin. Melatonin is something that our pineal gland in our brain produces, and it tells us, sun is down, it's time to go to bed. Oh, sun is up or sun's about to go up, it's time for us to wake up. Sometimes we just need a little boost. So melatonin is out there, and there's different dosages for different people. I usually start at 1 milligram for our kids, and it's natural, right? So you start giving that supplement, and sometimes about 30 minutes to 45 minutes before sleep, and before bedtime, and that helps with sleep. If it is just a sleep issue. But if you think it's deeper than that, then you have to go to your healthcare provider to try to figure that out.
Okay, so it's my takeaway, and again, I'm just thoroughly enjoying being in your presence and obtaining the knowledge that you have as it relates to this subject matter. But having a teenager, and I only have one child, so I don't have all the answers, but dealing with mental health, and whether it's 0 to 18, 0 to 21, I personally have a teenager. While we're identifying mental health and we're trying to be proactive as it relates to our children, we have to be mindful of anxiety. We have to be mindful of depression. And one of our best defenses is to identify their sleep patterns and whether or not there is a level of inconsistency or abnormality there. Mm-hmm. And what I really love that you said when you was talking about Florida Community Health Centers, I'm saying, well, hey, what about the families that don't have insurance or they can't take off work? Gary, you sat up here and said there's a sliding scale for you.
Yes, there is.
That equated to me as no excuse.
No excuse.
We can save our children.
We can.
But we have to be in tune. We have to be aware.
You have to talk
and we have to be
kids.
active/proactive.
Exactly. Because at the end of the day, I always tell myself how scared I am, with children, because you can try all you can and the child is going to turn out however they want to turn out, right? You have to pray for them. You have to guide them, of course, but you can always do your part. And your part is to support your child,
Amen.
To talk to your child. And I know it's hard for the parents out there who are working 2 jobs or, who only have a one-parent household or who are struggling. I understand it's hard, but our priority is the growth and development of your child, especially when they're that young. Mm-hmm. Especially when they're that young, their brain is so malleable. you know, like things, they get so affected by the outside world.
Absolutely.
So we have to protect them, and we have to shield them from whatever is going on.
And we have a responsibility to be in tune to what our children are experiencing and cover them at their capacity.
Exactly. I wanted to say thank you for having me here today.
I'm honored, honey. Thank you. No, thank you.
And thank you for giving me the opportunity to talk to our community about this very important topic, because at the end of the day, like I said, it's not just about your physical health, it's about the mental health too, especially at these ages when their brain is so malleable. So talk to your pediatrician. We're here to help. That's why we came into this specialty, because we care about the kids and we care about advocating for them
during this time.
Exactly. And social media and all of that. So another thing I wanted to say, to limit your the kids' access to social media.
That's
okay?
Good. Say it louder.
Yes, limit access to social media. They should not be on there for too long, and you should also notice what they're doing on their social media, because bullying happens a lot on social media too. So if you guys have any questions, any concerns, I'm Dr. Bettina Morenci, and I'm always at Fort Pierce, Florida Community Health Center, from 8 to 5 every day, Monday to Friday.
Which branch? Tell them which branch.
So we're at the Fort Pierce location.
Well, there's more than one, right? Isn't there one on Delaware and one in Lincoln
The
Park?
one in Delaware, yes.
Oh, okay.
Yeah, 1505.
Lincoln Park, my favorite.
1505 Delaware Avenue.
1505 Delaware Avenue. You guys have been graced with the Dr. Bettina Morenci from Florida Community Health Centers with a wealth of experience in the areas of mental health, and we'll just say pediatric. And we're talking about anywhere from birth to 18, and depending on how your insurance operate on your job, up to the age of 21. She's enlightened us so as it relates to this matter, and how to advocate for our children and even the individuals in our community that come and knock on the door for a frozen cup. Let's be mindful, let's be aware, and let's protect the children. It takes a village. Yep. And I thank you for listening to The Village Radio, WJGW 107.5 FM.
No, go ahead. I just was saying, say that, sister. Go ahead.
I thought you had cut it. We give honor and credence to Pastor Hazel. We thank her for this platform to educate the community as we all continue to work together, to be educated together, to rise together. Keep in mind, if you don't take nothing else away from this conversation, if you don't remember my name or the doctor's name, understand that there is a sliding scale fee over at Florida Community Health Centers that simply equates to, no matter what the issue is, although we're addressing mental health today, there is a sliding scale fee, which equates to there is no excuse for not addressing what we think needs to be addressed. And I know I'm right about it. I ain't going to have church with y'all, but even Luke, the great physician, made it to the Bible. That's my indication that God knew we were going to need doctors anyway.
Yes.
Oh, man, you guys were amazing. We thank God for the opportunity. We want to acknowledge Florida Community Health Center. Doctor, we appreciate you for coming in. And Janie, we appreciate you for being the great host that you are. You have been listening to The Village Radio, where still, of course, takes a village, and it always will take a village. We are until next third Thursday in the month of December. We will see you then, and we thank you guys for watching, whether it's on Facebook Live, on TikTok Live, or if you're listening on the radio. We here at the Village want to wish you great holidays, and we'll see you on next third Thursday with Ask the Doctor.